So first, I'd like to tell you a few minutes about myself. I'm a physician in California, and I started out always being interested in alternative medicines and natural medicines. And I worked with a lot of people with nutrition and vitamins and herbs and things like that. And when cannabis became available in California 20 years ago, more and more of my patients were asking me for information on how they can use it. And there really wasn't any information on how they can use it. Even to this day, most of the doctors in the United States don't know anything. So I've also been an educator, and I made it my business to learn more about how the cannabis works. And I actually have been teaching doctors now as well. So I'm happy to be here and help bring some of that knowledge to Israel. I have a long presentation. I'm not going to go into all of it. Maybe if I come back in March, we'll go into detail, but I want to show you some highlights. And so now I see about maybe 70 people every week, and I consult with them on how to use cannabis, and I tell them how to use it and where to get it and how much to take and how to reduce their other medicines. And it's very rewarding because I would say at least half the people I see can reduce a lot of their other medicines. So we're going to talk about a special topic that I'm very interested in, about the different ways to use cannabis. And this instilled in me a desire to educate people about all the different ways to use it. So I made a poster, which is this, about the 6 different ways to use cannabis. And this is about 5 years old now. At that time, and still to this day, many people are saying, well, you can't use cannabis as a medicine because you have to smoke it. So that's why I made this poster, to show the 6 different ways, and we're going to look at all of them. But really quickly, we have going in a circle. In English, we go left to right. But this time we'll go right to left. So on the bottom is topical, and that's the kind of cannabis you put only on your skin. And when you do that, it doesn't enter into your head, and there are no psychoactive effects, and it affects only where you put it. They don't have this in Israel, I think, but they should bring it.
We had.
We have.
We had.
Good.
The minister cut it 5 years ago.
All right.
Yeah.
Learn. Had. Okay. The second one is the kind of cannabis you put under your tongue, or it's absorbed in the mouth directly. And that has a special category because its activity is different than when you swallow it. So we'll see. Sublingual. The third one is vaporizing. You've seen some vaporizers here today. That's an inhalation method without smoke. Then there's smoking, inhalation with smoke. Then there's ingestion, where you're actually swallowing something and it needs to be digested and absorbed from your digestive tract. And then raw cannabis is something that is not widely available anywhere. In some parts of California, they grow so much plants that people can actually chop down as much as they want and grind it up in a juice and take it fresh. So we'll begin. Suppositories, another one. Suppositories were not available when I did this 5 years ago. So first I was going to give you a little overview of the type of the patients that I see. And in the United States, pain is the biggest indication for cannabis use. And we did a survey at one of the clinics that I worked at. There were about 2,000 patients that did the survey. And they filled out what they used the cannabis for. And as you see, pain was the main reason. And we'll go on to the next chart. It'll show all the numbers. And at that time, in 2006, still most people were smoking it. But also you can see that many people were swallowing, using vapor, and very little topical use. 10 years ago, this was the case. Now it's about half and half. Half smoking and half everything else. So this is what's interesting, is that pain is the most in these clinics that I worked at, but the second most, very high, is also for sleep. And a lot of people don't realize that cannabis can actually replace sleeping pills very effectively. I do it all the time with my patients, if you use the right kind.
Which kind?
The strongest.
You know, we used to say it had to be an indica. That's not necessarily the only thing. There is a cannabinoid you saw that Saul presented called CBN. CBN is very sedating. So there are some products that have a higher percentage of CBN, and that makes you very tired. Well, actually, it's the ones that cook.
Yeah.
So you can't smoke it and get a lot of CBN. But if you, when you cook it, that's a lot of heating, and it turns a lot of product into CBN. Part of it. Okay, and then the next thing we see is headaches. For migraine, I have not seen a single medicine work better than cannabis. 95% of the people with migraine, the cannabis takes away the headache, but you have to use it right at the beginning. You can't wait till it gets bad, because it actually reverses the physiology pathway right at the beginning. And then the next we see is for mood disorders. So I'll move on. And we talked about that. So now we're going to spend some time talking a little bit about the different delivery systems. I'll just bring you some highlights from these slides. So down at the bottom, a large study found no association between marijuana smoking and lung cancer. So this is a study done by Professor Tashkin in Los Angeles, California. And the government funded him to do a study to prove that when you smoke cannabis, you get more lung cancer. And he was convinced that that's what he was going to find, and it's not the case. Actually, he found that cannabis has an anti-tumoral protective effect, and the patients who used cannabis had less lung cancer than the patients who did not use it. So it's not to say that smoking is a really good method. It's still irritating to the lungs, but this was a revolutionary. It came out in like 1990 or so. And the thing that we want to know about smoking is that it is the fastest, easiest, most commonly used method. And here's some different ways you can smoke it. And there's different kind of pipes. I don't know if they have dabbing here in Israel, but this is a very dangerous method. And that's when you put very concentrated oil onto a hot glass tip and inhale it. And it is the only time that I've ever seen cannabis toxicity in any patient. With some young people that are dabbing every hour, every 2 hours, they have such a high concentration in their blood that they really get sick. Yeah. Okay. So just to see that the smoking comes on very fast and it's over in 2 to 4 hours, compared to eating, which takes 1 to 2 hours to begin, and then it's not over for about 10 hours. Okay, so it's been measured that there's maybe up to 1 gram of cannabis in 1 joint. Just so when we get to dosage, you'll remember that. 1 gram of cannabis in 1 joint. And the thing to remember about smoking is that it's most convenient, but it's very short acting, and it can be irritating to your throat. Everyone knows about smoking, so I'm not going to go too much more into this. I I don't have one dose that I recommend because it depends on the condition. And that's the important thing. You have to individualize the medical prescription to each patient's needs. Okay, so vaporizing is next. It has the same kind of profile as smoking. It comes on fast. It's gone in 2 hours. And here's some examples. I wanted to show you the one on the right in particular. This is called a pocket vaporizer, and we have many different kinds now in the United States. It's small like this, but it still fits in your pocket, and you can put real marijuana in here. So you can carry it around, but you don't have to put oil. Like the next one. These are all the pocket styles, and the problem with them is that they all use cannabis oil, so it's very concentrated. And when you extract oil, usually you lose the terpenes, so it's not a full product. So the portable vaporizers that are like small, like these pens, you don't get the full product. Never. Excuse me. To make the oil? Yeah. Let's do the questions at the end, okay? Yeah? Okay, so the same thing, but they found that with vaporizing, many times they have to use a larger dose because it's not as efficient as smoking. So it depends on the efficiency of the device. Some vaporizers are more efficient than others. The ones that cost a lot are better efficiency. Okay. So the advantage of vaporizing, if you want to have short acting, it's not irritating to the lungs. So I know a lot of studies that are being done in the United States. In the United States, the only way you can get marijuana for studies is the raw plant. That's it. Anyway, you can't even get that, but the few studies that they approved is the raw plant. So the only studies they've done in the United States were either through smoking or vaporizing. That's it. Okay, so now we're moving quickly through eating, and what I want to say about ingestion is that it has a much higher dose that you have to use, but in the long run it lasts 3 or 4 times longer, so it's about the same dose. And again, to see how long it lasts, many hours. And here's some different methods of ingestion. What I want to point out here is that cannabis tea is a medicinal product. And they use this in Amsterdam a lot. They use it in Jamaica. It's a lot of ganja tea. And you've seen on the chart where I talked about THCA. And it turns out that when you heat the cannabis to put it in water, THCA dissolves in water, but THC does not. So really what you're getting when you make tea is a lot of THCA. If you want to get THC in tea, you have to cook it also with some milk or some butter or some kind of fat. There's the concentrated oil that the cancer patients use in the United States. Very concentrated and lots of it and a lot of milligrams. We'll talk about that again. Chocolate's really important because it's a way of, patients like it and it comes on fast and it's cooked. Very good for sleep. Okay, so a little bit about high dose ingestion, and that's where you get the high milligrams. So you're going to find that for the kids with the seizures, you're going to find that with the cancer patients, you're going to find it with patients that are in really a lot of pain and have developed a tolerance. And usually in the high dose options, they're all by ingestion. You cannot smoke enough to make a really high dose in your blood. It's not possible. So what are the advantages and disadvantages? You know, the problem with ingestion is that it's easy to overdo it, and I can't tell you how many patients have their first time they use cannabis and they'll eat a whole cookie and they get paranoid, they get sick, they have to go to the emergency room, and it's not easy to control the dose. One of the ways around that is to make measured capsules, of course, and you know exactly what you're getting. Okay, sublingual is my favorite category of delivery. These are ways of swallowing the marijuana where it dissolves immediately in your mouth. And mostly it's by a tincture or a spray or a sucking candy. They have mouth strips now. So sprays, tinctures, sucking candies, sublingual tablets also that are available that dissolve in your mouth. And mouth strips. You suck on it like dissolves in your mouth. In the United States, there's some difference in the kind of drops you can get in a bottle. Drops that are made of oil, sometimes they call that tinctures. They're not really, because tinctures have to be an alcohol or some other solvent extract, not oil. But they do have drops of oil and drops from alcohol. There's also drops from glycerin, but we don't use that very much. It's not very efficient. Okay, we'll skip that. So, what's good about sublingual dosage is that it lasts anywhere from 4 to 6 hours. So it's like a 4-time-a-day medicine, and it's very cost effective. Because in a whole bottle you can get like 30 doses, which makes it a lot more cost effective than capsules where you get 1 dose at a time. Okay, so now we're moving on to the topicals. And the topicals are really what you put on your skin, and the effectiveness of the topicals is 100% dependent on what's the solvent they use to make it in. Some topicals stay only on the skin, and that's good for like psoriasis or dermatitis or other skin conditions. Some topicals get through the skin into the joint underneath, really good for arthritis. I have many elderly patients that use topicals for their arthritis, and they really like it. People in their 70s, 80s, 90-year-old, lots of them use topical cannabis. The advantage of topicals, of course, it doesn't get in your brain, so you're not getting stoned, so nobody's afraid of it, even the old folks. Here's some examples of topicals: lotions, salves, oils, and here's a patch. So we do have one company that's making patches now. And the patches are a little bit different because they're actually designed to be absorbed through all the layers of the skin. So they actually do get in the bloodstream with the patches. And as you see, this is a CBN patch. It's designed specifically for sleep. If you have someone who can't sleep, if they use this, they'll sleep. Yeah. Okay, so topicals use a lot of medicine. They're not cost effective. They use a lot of medicine because they have to cover a large area. They use maybe 4 times as much medicine as what you take inside. And the main advantage, of course, is no psychoactive effect. I can't tell you what a big selling point that is, because we have patients that are afraid to use cannabis, and they'll start with a topical and they'll see how good it works, and then they'll come back and they'll want to try something else. Okay, this is just another method we use a lot in California because there's so much plants, but this is when you take the cannabis fresh off the plant. It's called raw. And here's a typical plant or a plateful to make your daily dose. And you can juice it with some other vegetables and drink it throughout the day. And it's extremely helpful for chronic disease. I've seen many, many people who have fatigue, who have cancer, who have autoimmune disease, who can't get out of bed. 1 month on topical, and they really, really, really feel better.
tastes like shit, though.
Well, you gotta put in other vegetables. Yeah. Tell you it tastes. Yeah. Okay, and so there's not too much known about topical at all, but the idea was to use the leaves from the plant instead of throwing them away. Might as well put it in the juicer. But leaf mixtures have about 10% the dose of cannabinoids as the buds. The same with terpenes. The terpenes are produced in the trichomes up at the top, not in the leaves. So it's not a very strong cannabis medicine, but it works. And then, of course, you know that with raw, if you never heat it, you're really not getting any THC or CBD. You're just getting the THCA or the CBDA or the CBGA, which is why it might be working, because CBG is 10 times as potent as THC. So you don't need so much for everything. Well, for many things. Yeah, a little bit, yeah. Okay, so let's move on to talking about dosage. That's what the rest of this talk is about. These are the different delivery methods. Really fast, we're done with that. So what is the most important thing in dosage? Big letters. This is true in the United States to this day. Many products are not lab tested, so we cannot determine accurate dosage. Even to this day, there are many people who grow their own plants, for example, and they make their own medicine and they have no idea what they're taking. And in the United States, there are many people who do that. They're in an area where they don't have dispensaries. So the law says that they're allowed to grow their plants, but the county says we don't allow dispensaries here, so they can drive for 4 or 5 hours and to get medicine, or they can grow their own and make their own, and they don't know what they're getting. There are many states, even to this day, where the law says, okay, you can have cannabis and you can grow it, but they have not one dispensary open in the whole state. So this is the state of the art in the United States. If you're lucky enough to live somewhere that has a dispensary and a store that sells cannabis, and it's a good one, and they only use lab-tested products, then you know what you're getting. Okay, so this is to review that we're working with a plant. And it's very important because for some crazy reason, in most countries in the world, including the United States, they've decided that the doctors should be the ones to decide how a person should take a plant. And medical doctors have no training in herbalism, and they don't understand about plants. And it's a big problem because plants are very different. They're trying now to get around it by saying, oh, if you take this part out and this part out and this part out, put it back together, it's called the entourage effect. But there are things in the plants we still don't know, and the plant puts it together in a very stable, natural way, and that's called herbal medicine. And cannabis contains more than 400 chemicals, over 60 cannabinoids, and over 120 terpenes. Having said that, there's only about 4 or 5 main cannabinoids and about 6 to 8 main terpenes. So it's possible to do lab testing of that whole profile of those 15 products. However, it's not cost effective, and nobody's testing terpenes hardly ever. But that's what's in the plant. And most herbal compounds can be safely added to other pharmaceutical medicines, including cannabis. There's only 1 or 2 medicines that I know of that it might interfere with. For example, it interferes with a drug called warfarin, which is used for blood thinning, and it makes it more potent. It actually interferes with opiates in that it makes them more potent. Usually what it does is it makes the medicine more potent, but it's not dangerous. So this is a possible avenue to work with people who are taking many medicines without worrying about adding another one and having what we call polypharmacy. We can use cannabis instead. The next thing you need to understand with dosing is that your dosing needs change with use. That's called tolerance. And this is something that patients don't really understand as far as dosing. They know that they get used to the pot and they have to use more, but they don't really understand how to deal with it. So tolerance means that the more you use something, the more sensitized you get to it, and then the more you need to have effect. One of the strategies that we use is to change strains, because there are different components. As we say, CBD doesn't bind to the same receptors as THC, so we can change, the percentage of CBD and THC, and we can also, we don't know yet how much the terpenes affect dosing, but they do. And this is a typical tolerance break, or I call it the herbal holiday. Yeah. So you should take off either one day every week, or some people like to use their cannabis all day long and all year long, and they'll take off 1 month every year, and some people 1 week a month. But it's really important to take an herbal holiday or a tolerance break if you're reaching your maximum saturation, because then you're not going to get the effects of the medicine that you want, and you'll have to use a lot of medicine, and it's not smart. So it's important to take a tolerance break. Okay, the next thing we need to know is about frequency. So how many times a day do you take your medicine? And that is totally dependent on how long your medicine lasts. So if you're smoking and it lasts 2 to 4 hours, that's not very convenient, especially in the middle of the night. For example, many people who use cannabis to sleep, and they still take their sleeping pill. And I say, why are you still taking your sleeping pill? I say, well, I get up in the middle of the night. And I said, well, that's because you're smoking it, right? I tell them to take the kind, to swallow, but they like to smoke. Well, if you want to get off your sleeping pill, you have to swallow the cannabis. It has to work for 6 to 8 hours, and that's why you're waking up in the middle of the night. So the delivery method is very important in choosing your frequency. So with edibles, you can maybe get away with twice a day. With sublinguals, 3 to 4 times a day. Smoking, 6 to 8 times a day. And then you also need to look at your condition. Is your condition worse at night? Is your condition worse in the morning? Is it only once in a while? So that will also help you decide which delivery method. And every patient should self-titrate to find their own dose. This is important not only because of tolerance, but because cannabis works on a system that we have in our body, the endocannabinoid system. And everyone's endocannabinoid system is different. So you can't give one dose for all people. Some people have a low efficiency endocannabinoid system, some people have high efficiency, some people have variable, and they change with the cycles of the moon, and they need different support at different times of the month. So it's a self-titrated project. So here's some dosing tips. This is pretty much the conclusion. If you want psychoactive effects, then you want something with THC. A typical regimen would be that you can use your stimulating sativa in the morning, you can use your sedating indica at night. That's one possibility. If you want also to stimulate, then the THC is good for depression, fatigue, for ADD, or focus. And THC, again, is used for pain. Contrary to popular belief, CBD is not useful for pain in general because it doesn't bind to the central pain receptors. It is good for inflammatory pain, but it has to be that kind of pain. And then, of course, the CBD is not psychoactive, and that's very helpful when you don't want psychoactive effects. So I did this slide a little bit of a while ago. When do you use CBD? You use it when anti-inflammatory. You use it when you want to oppose the psychoactive effect of THC. For example, if you want pain management, and you want to take THC during the day, but you don't want to be stoned all day. You got to go to work. Then you can use a mix with some CBD in there, and you don't get as altered. You still get your pain management. CBD is also used as an antipsychotic and good for anxiety because it calms the nervous system. Well, children, it's a personal decision as to whether you give anything to children. Most children who use cannabis are using it instead of a pharmaceutical which the parents feel is worse for them. It's a personal decision. Am I going to put my kid on Ritalin or on seizure medicine, or am I going to try them on cannabis? Okay, and then also you have to consider the terpene profile when you're doing your dosing. I think that's my last slide. These are references. I'll leave that up there in case anyone wants to take a picture. Okay, and thank you. That's my contact information. One more slide. And this is a course that I'm the medical director of, teaching doctors how to do cannabis medicine, and it's available on that website. Thank you very much.
When a doctor treats over 25,000 patients, she learns a few things about a few things. So we'd like to take this opportunity to invite Dr. Malka back up to the stage and ask her some of our questions and some of yours. So we wanted to talk, so one of the questions that came in is about what Israel has to learn from the United States and possibly vice versa.
That's a big question. Well, I don't think Israel is in that much of a different condition than the United States. Our government is still very ambivalent. Our doctors are mostly ignorant. The patients are very educated. So I don't know what the situation with the patients in Israel, but that's one avenue that's been working in the United States, the grassroots effort, and I would encourage that as an avenue of success.
Sounds good. How are you accepted by your peers in the medical community?
Well, you have to remember I was an alternative doctor my whole career, and I live in a very a liberal place in the United States. So on the coast of California, it's not very conservative, so I'm fortunate. I can say though that in the past 4 years, I've had more referrals from other doctors than I've had in my whole career. So now I have maybe 30 doctors that refer to me. A lot.
These are all medical doctors.
Medical doctors. One, because their patients are getting good results. Two, because they really can't do any more with their medicines and they're looking for something else. And three, because I give talks like this to doctors and they find that it's valuable in their science, and that helps them change their mind.
Amazing. Thank you. What are some of the biggest changes you've seen over the past 3 to 5 years?
The availability of CBD medicine has changed medical cannabis in my area. Totally changed it. Now I have, 30% of my practice is older, from 70 to 100 years old. Those were people that They don't want to get stoned, but they'll use CBD. So, and also CBD for children. And also CBD to mix with the THC, so you have a way to get the benefits of the THC and still go to work during the day. That's one of the biggest changes. The second biggest change is that most of the dispensaries where I live now use lab-tested medicines, so there is a way to measure what you're getting.
We have some questions that came in outside. Someone wanted to know if there are any evidence that medical cannabis can treat ADHD.
I have not seen a single article where there's been a clinical study. And I have to say again that almost all the evidence clinically for the use of cannabis is anecdotal. All. Because nobody's funding clinical studies. It's been a big problem, and it's still a big problem, and so you have to remember that when we don't have clinical studies, it doesn't mean there's no evidence, it means that it hasn't been done yet. We really don't have that. So anecdotally, yes, many patients that get off their medicine for ADHD and use cannabis instead, and yes, and there's some case reports in the literature.
Okay. Looking back on your career, are there any changes you would have made along the way?
Not so far as cannabis, which I'll leave it at that.
Fair enough.
I know, I'll give you a real answer.
Yeah.
The real answer is a real answer. After I got my medical degree, I had 3 small children, and I decided not to pursue training in a specialty, and that has limited the kind of work that I can do. And if I had it to do over, I might have actually put in, the 80 hours a week to do the residency and raise 3 small children, but I chose not to do that. So, in a way, that's what brought me into cannabis medicine, because it's one of the avenues open to people who just have a degree. And I don't think I would change that now, but it's been an issue.
There's another question that came in from outside about how medical cannabis can impact the treatment of fibromyalgia.
Well, it's used very successfully by many people for 2 or 3 big reasons. We know cannabis is a muscle relaxant, so there's a lot of stiffness in fibromyalgia. 2, it's an anti-inflammatory. There's a lot of inflammation in myalgia. 3, it reduces pain. There's a lot of pain in fibromyalgia. And 4, more importantly, is it elevates your mood. And fibromyalgia almost always is associated with a lowered mood. And 5, it's almost always associated with lack of sleep. So there it covers the whole spectrum.
Some people say it's not a busy.
Well, I called it a spectrum. Yeah, it's very good for everything, so why not?
I'm taking on a tour of a whole lot of different questions that are coming from different areas.
That's
right?
fine.
What would you say is the most gratifying part of the work that you do?
I love getting people off their pharmaceutical medicine.
Can you unpack that for us a little bit?
It's very gratifying, because what happens is that they're starting, probably in Israel too, they're starting to give out more and more medicine at an earlier age. So when I first started practicing medicine, my average patient that might be 40, 50, 60 years old, they didn't have any medicine, none. Now, they're giving medicine at 20 years old, so by the time you get to be 60 years old, you're on 5 or 6 or 10 different medicines, and then you begin to have the polypharmacy effect, which is a real problem. Too many medicines, you can never be clearly yourself. So cannabis really is pretty much the only tool, I can say that honestly, the only tool I've ever found in all my alternative training that can really help a person detox from their medicines. It's not to say there aren't things a person could use once they're off their medicine, but cannabis is so strong that it can really replace medicines.
On that note, in terms of being yourself and allowing medicine to help you be your best self, how would you say that cannabis affects one's being in their presentation to the world?
There's not one answer. It can either increase your perceptions, and that can be helpful, or if you're a fearful type person, maybe it can increase your paranoia, and that can be a problem. So there's no one answer. For example, I don't use cannabis except topically because I think my head is fine, and I don't have pains. I don't have an indication. So for me, if I'm not treating anything and I just use it to change my consciousness, it's not helpful to me. But if I had a need to change my consciousness, then it would be helpful. Yeah.
Well stated. There's another question here that came in from an attendee about the advantages of cannabis in treating MS.
Okay. It's a lot like fibromyalgia, actually, the same answer. If you look at the symptoms of MS, which are stiffness, fatigue, sometimes neuropathic pain, not always. It certainly helps with the symptoms. There's also a thought that MS is an autoimmune anti-inflammatory disease, and cannabis is helpful in those regards. And we do have many patients who have MS who are on cannabis for many, 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 many years. They don't look like they're getting worse with their MS, so there's a thought that it could be preventive. Yeah.
Okay. Based on your experience, what are some of the what kind of tips can you offer patients to push for change in this field?
I don't know what the situation in Israel is with access to growing your own medicine, but that's what happened in the United States, is that patients lobbied for the ability to grow their own medicine. They also did a lot of grassroots work with their local representatives, so still at the federal level they haven't had success, but locally they have. So the smaller the group you work with, the more likely you are to have success. And so it spreads like from one person to another, and you have to be patient because it takes time like that. No, I want to say, the way that I've had success with my colleagues, I do not fight anyone. I do not create change by fighting, but by joining. So we'll work together. I always send all the doctors that send me people, I always send them a letter. I always try to include them. So the way to make change is to include in the larger picture, not to oppose. That's my answer.
Amazing.